Laboratory staff hunting for the leading killer in Nigeria, the Plasmodium parasite which causes malaria. The disease is responsible for more than 40% of infant deaths and 20% of Nigerian mothers. Experts say recent advances in rapid diagnostics testing have increased the chances of survival.
The advantage of this test is you don't need a microscope, you don't need a trained microscopist, and also you don't need electricity. It's going to reduce the expenses.
Access to reliable testing rose by 22% in sub-Saharan Africa over the past 5 years. But the region accounts for 90% of malaria infections and 92% of recorded deaths last year. Hospitals and pharmacies in the ancient city of Kano were overloaded in October when a malaria epidemic broke out. Hundreds died across Nigeria. It's been 2 months since the disease claimed the lives of Shehu Aliu's children.
I lost my 2 children in the space of 1 week. They all came down with fever. We had blood tests and drugs, but they didn't help.
It's easy for mosquitoes that transmit malaria to find breeding ground in many communities.
At the heart of the high rate of mortality are issues of poor infrastructure, hygiene and poverty. It's common to see blood drains and pools of water like this around residential areas. Poor funding of clinics by government and inadequate treated bed nets are also partly responsible.
A campaign to protect more than 25 million under 5-year-olds using a combination of drugs was launched in the Sahel region 8 months ago. But a shortage of government funds has limited coverage to less than 1 million children. Improved access to good diagnosis and protection has helped some, but until infrastructure, funding and personal hygiene improve, millions of sub-Saharan Africans remain exposed to the continent's biggest killer.